All right, today we're going to talk about the vaccines in more detail since so many of the vaccines are now out. We have 3. And before we get to talking about each specific vaccine, I want to review our immune system again so we understand why the vaccines work, okay, and how they work. Now remember, the COVID virus, it's called the SARS-CoV-2. That's the official scientific name of the virus, and this is what it looks like. And the key to this picture is I want everyone to focus on this part. These are the spike proteins, all right? So usually when we talk about the virus, we're talking about the spike protein, and most of the vaccines work on forming that and fighting that spike protein, all right? So this is what the virus looks like. And remember, this is a normal person. They're exposed to the virus and they get sick. And when they get sick, they have the virus in their body circulating, causing havoc, okay? Now, when the virus is in your system, our immune system is going to be triggered. And the important part of the immune system that is triggered is this part right here. All right, this is what fights the virus. The macrophages, the T lymphocytes, and the B lymphocytes. So the virus goes in your body, these come out of the immune system and start fighting the virus. Now, in that fight, we form certain things in our body. When we're fighting the virus, our body is going to form memory cells, which is important. And it's going to form antibodies. And this is the key. This is the immune response that we need when we get exposed to the virus. We form these. And so once the fight is over, these are circulating in your body. And thus, the next time you are exposed to a COVID infection, your memory cells remember what happened. It remembers what the virus looks like. And it kicks in and starts fighting again. The antibodies kick in and also start fighting again, okay? So these are important, and this is called your immune response. Now the key to this that I want everyone to remember is this is the normal process when you're exposed to the virus. This is what your body does, okay? So we are trying to bystep this part. We're trying not to let you get sick from being exposed to the COVID infection. What we are trying to do is give you a vaccine to trigger this response. So the vaccines okay, you get your vaccine. It has a component of corona DNA or RNA or whatever it is. It has a little piece of the coronavirus in there that is injected into your body, and your body forms this response. And so what happens is your vaccines trigger your immune response. That's how they work. Okay, and so the next few minutes we're going to really focus on each of the vaccines, pros and cons of the vaccines, and which ones are recommended for which group. I'm also going to talk a little bit about some of the vaccines that we don't have yet here that we possibly are going to get in the future for the United States. And I'm also going to mention 2 of the more famous let me rephrase that. I'm going to mention 2 of the vaccines that we are not likely going to get, but they're using in China, they're using in Russia, and they're using it actually all over the world except the United States, okay? So I'm going to mention all these in a little bit. All right, now we're going to talk about the types of vaccines that are out there. And there are roughly 3 types of vaccines that we're dealing with our COVID vaccination, okay? So first one is called the vector vaccine. And what this does is it gets in the lab, scientists get a little inactivated virus, like a common cold virus. They get that little virus and they put a smidgen of COVID into that virus, right? So we expose your body to this little virus, and once it's inside your body, the COVID genetic material comes out and your body fights that material. It sees that spike protein and it starts forming your immune response. That's how that works. And this vector vaccine is called the Trojan horse vaccine, and that's why, because we inject the piece of COVID inside something else. So we trick your body into, getting that virus in there, not doing anything with the virus, because remember, it's a dead virus, you can't get sick from it. But then when that little piece of COVID comes out, that's when the immune response happens, all right? So that's the Trojan horse virus. Trojan horse vaccine. Now, the mRNA vaccine. This one we know about, we've discussed it a lot. It's the Pfizer and it's the Moderna vaccine. And what this is we get a little piece of the COVID mRNA. It's surrounded by a little piece of fat, a lipid molecule, and that's injected into your body. And once inside your body, it goes into your cells. That little bit of lipid surrounding the mRNA of the COVID goes away. Your body sees that mRNA and it starts forming an immune response to that COVID mRNA. That's how that one works, all right? So that's the mRNA vaccine. Now, the last one is the protein subunit vaccine. And this one is just, we get a harmless little piece of COVID, meaning it's dead, it cannot cause infection, and we inject that into your body, and that will trigger its immune response. All right, so all the vaccines have inactivated COVID, all right? You are injected with a certain amount of COVID, but these are all inactivated. They cannot give you COVID. You will not get COVID from getting the vaccine, okay? Number one. Number two, the goal of all these vaccines is to trigger your immune response. That's the key. Remember, we're trying to trigger your immune response because once it's triggered, your body now remembers because it has those memory cells. It has those antibodies that have been triggered by the vaccines, and those are circulating in your body. So the next time you're exposed to COVID, your body remembers and says, oh, we don't like this, and it's going to fight that infection. So that's how the vaccines work. That's how it helps prevent you from getting an active COVID infection, all right? So these are the types of vaccines, and now I'm going to go into detail with each vaccine about the pros and cons of the vaccines. Now, I'm going to start with the Pfizer vaccine. It's the first one we're going to start talking about. The Pfizer vaccine, okay? It's an mRNA vaccine. We know this. It's a 2-shot vaccine. You get the first shot 3 weeks later, 21 days later, you get your second shot, okay? Now, the special needs with the Pfizer vaccine is it needs very special cold storage, so it's a little difficult to really mobilize quickly. The other thing with the Pfizer is it's for 16 years old and older, okay? This is the youngest age group that we can go in with any of the vaccines, and Pfizer is the only one that had the data in their studies, and that's why we're allowed to go down to 16 years old with the Pfizer. Now, it is 95% effective. It's a great number, okay? And that means if you have 100 people and 95% of them will be immune to the COVID virus, they won't get it. The other 5% might get COVID, but they're going to have such a mild response to the COVID, they are not going to get sick enough to be in the hospital, they're not going to have a severe COVID infection, and they are not going to die from COVID. So that's key, okay? So 95% effective. The other thing I do want to mention is after that first dose with the Pfizer vaccine, it shows that a week after you get your first dose, you're at 52% effective. In other words, roughly half of the people that get their first dose of the Pfizer vaccine will be immune to getting a COVID infection. It's a decent number, okay? Now, the key with the Pfizer that I do want to mention is allergic reactions. We've heard of allergic reactions. And so I'm talking about severe allergic reactions, where you get, your reaction consists of swelling in your face, your tongue, your lips, your throat, to the point where you might not be able to breathe. Now, these patients, it does happen occasionally to patients, this allergic reaction, and usually happens to patients that have a history of allergies, of severe allergic reactions, which in the medical community we call anaphylaxis. That is a severe allergic reaction, okay? So these patients I know have been holding off on getting their Pfizer or Moderna vaccines because they're a little concerned about that. And I understand that. So, you know, for now, we, now that the vaccines have been rolling out, the numbers show that roughly for every 1 million people that get the Pfizer vaccine, okay? So if you have 1 million people that got the Pfizer vaccine, about 2 to 3 of them will have an allergic reaction to the vaccine. Now, having said that, when I looked in the literature, it shows that the people that have had allergic reactions to the Pfizer vaccine, no one has died. Everyone has responded to medication. A few people had to be hospitalized for a day or two. But again, these are people that have a history of allergic reaction, okay, severe allergic reactions, and they knew that beforehand. So I think right now, if you have a severe allergic reaction and you're concerned and you haven't gotten your vaccination, I understand why. And as I go through all the vaccines, it looks like we're having one coming up through the pipeline that's going to be a good option for you. So this is the Pfizer vaccine. All right, so we're going to talk about the Moderna vaccine now. Moderna is an mRNA vaccine. It is also 2 shots, except this one is going to be 4 weeks apart, 28 days. Okay. Storage for the Moderna vaccine also is a little difficult. It also needs a very cold storage, not as cold as Pfizer, but it still needs a little special extra storage. Now for the Moderna, we can only give it to people that are 18 years old and older. That's all the data that we have in the study. They didn't go younger in their study. So for now, you have to be 18 years old or older to receive the Moderna vaccine. It is 94.1% effective after you get that second shot. Now, interesting, we're noticing though that after you get your first dose of the Moderna, about a week after your first dose of Moderna, you have an 80% effective rate. So again, even just getting that first shot helps. It helps your immune system. It helps decrease the chance of you getting COVID and getting sick. And the one thing, special population with Moderna, I do want to mention, because you'll see it in the news, you might hear, oh, Moderna is not as healthy or is not as effective in older population. And based on the numbers, you can say that is true. But I want you to really look at the numbers to really decide, is it really, really true? So the data shows that if you're older than 65 years old, they were able to look at the data, space it out from everyone that was younger than 65 in the initial study, and they noticed that people that were 65 or older with the Moderna vaccine only had an 86% effectivity rate. 86% versus 94%. So again, we can argue about the percentage, but the bottom line is over 4/5 of people that are greater than 65 years old getting the Moderna are going to be immune to COVID. And at the end of the day, under 65, over 65 with with Moderna vaccine, doesn't matter. At the end of the day, you're not going to have a severe COVID infection, you're not going to be hospitalized, and you will not die. So again, this is true that older 65, their effectivity rate was a little bit lower in the Moderna study. But again, was it significantly lower? I don't think so. My mother got Moderna. She's 70 years old. I feel very relieved that she's vaccinated. So I really want to mention that because I know that's being said in the news, and really, it's still extremely effective. I just really want that to be the take-home point. Okay? Now, I'm going to talk about the Moderna and the Pfizer, since they're both very similar. And I want to talk about, number one, their side effects, and number two, the dosing of the second vaccine, because there's a lot of questions on that. So, personal experience, I got the Pfizer vaccine. My mother, 70-year-old, she got the Moderna vaccine. I've spoken to many people that have gotten both of the vaccines, and I have looked at all the data that's coming out with side effects. So I will say the bottom line is, with these vaccines, they're both 2 shots. The first shot, the side effects are very mild. Again, mild arm soreness, little headache, a little fatigue, a little bit of muscle aches after that first shot. Usually when you see more severe side effects, it's after the second shot, okay? And after the second shot, you'll see the same symptoms: soreness at the site where you had your injection. You're gonna have muscle fatigues, more intense. You're gonna have fatigue, more intense, possibly. Chills, also, fevers, headaches, and overall just not feeling well after that second shot. And I will say that a lot of people do have symptoms like that, and I've heard of people that have had to take that day off after the second shot because they felt so cruddy. All right, I will say that. Having said that, number one, a little bit of Tylenol, a little bit of Motrin, the day after, the day of the shot, the day after the shot when you're not feeling well works. And also, a lot of people I've spoken to and a lot of people in the literature have no side effects. It really is mild for a lot of people. So I really want to stress that. I know we're focusing on all the severe side effects some people are experiencing, but there are a significant amount of people that are having minimal side effects after that second shot. We don't know what your reaction is going to be like when you get yours, but just be aware that it is really a spectrum of side effects that people can have. They're easily treated. And at the end of the day, you might feel miserable the day after your shot, but the majority of people, those symptoms go away after the second day. And so you're fine 2-3 days later. I will say, if you're having weird symptoms after your shots, day 3, day 4, day 5, they're persisting, they are not going away, you need to call your doctor and discuss them with your doctor because something else might be going on. I do want to mention that. Now, the second issue I want to mention with these 2-shot vaccines is timing of that second vaccine shot, okay? Because there's been, a lot of questions. If you missed that second shot, how much time do you have to make it up? Or if after your first shot, you're exposed to COVID, then what do you do? Okay, or you're exposed and you're isolating, then what do you do when you're due for that second shot? So all these questions are great questions. And at the end of the day, what we did to answer this question is we looked at the studies, and there's a very small amount of people in the studies, but there were a small amount of people. I think the number was roughly around 80 people, and we're talking about 80 people out of something like 30,000. But there's a small amount of people that were late for that second shot. And so they received their second shot after the timeline they were supposed to get it. And so they looked at those people and they looked at their immunity, and it showed that even getting that second shot delayed was okay. They still developed a good immune response. So right now the guidelines are after your first shot, okay, so here's your first shot, right? And if you're Pfizer, you're gonna go 3 weeks. If you're Moderna, you're going to go 4 weeks, all right? Either way, you get your second shot here somewhere, okay? So this is your first shot. This is your second shot. This is either 3 or 4 weeks out, depending which vaccine you got. So for some reason, if you are not able to get that second shot on time, what the literature shows is you have up to 6 weeks or 42 days after that second shot is due to get that second shot. Okay, so that's the answer. So if you miss this shot for whatever reason, you have whatever date this is that you're supposed to get that second vaccine shot. From that date, you have 6 weeks or 42 days to get that second shot. All right, if you get it after this time period, then all bets are off. We have no good recommendations to give you. Okay. Now, I also want to mention another possible scenario which is happening, and I've been called many times by friends of friends that they're not sure what to do. So you get your first shot, and then after that you get exposed to someone with COVID, okay? So you have an exposure to COVID, and what do you need to do? You need to isolate for 14 days. Okay, so count. You have your shot, your first vaccine, you have an exposure to COVID, and you isolate for 14 days. And the reason we ask people to isolate for 14 days before they go ahead and get that second shot is because we do not want you to go to a vaccination center with active COVID and get someone else infected. We don't want that, okay? So we want you to be safe and not be infective to other people. So that's very important. If you get exposed, do your isolation. So you get exposed to COVID after your first vaccine shot, you isolate for 14 days. After that, get your second shot. If the timing works out where, your 14 days of isolation ends before you're due for that second shot, great, you're golden, go get your second shot. If the timing works out where your isolation days, your 14 days of isolation happens after the date you're supposed to get that second shot, make sure you call the vaccination place, the site where you got your shot, and tell them what happened, and tell them when your isolation date will be up. And so that way you can verify that they are going to have that vaccine for you so you can get your second vaccine. So that's what we need to do. Remember, you want to isolate. You do not want to go to a vaccination site with active COVID. But again, you have up to 6 weeks or 42 days, however you want to count it, after you're due for that second shot to be able to get that second shot. Right, now we're going to talk about the third vaccine that just got approved for the United States. And this one is called the Johnson & Johnson. And we usually refer to it as the J&J for short. So this vaccine was approved on the 27th of February by our FDA. It got the emergency use approval, meaning we can now use it for COVID infection in the United States to help prevent COVID infections. It is a vector vaccine. That is the one that's like the Trojan horse. There's a little virus that we inactivate so it cannot get you sick. Put a little piece of COVID in there, and once it goes into your body, that COVID comes out, your body recognizes it, and it triggers your immune response. It's a vector vaccine. It is a one-shot vaccine, which is good for a lot of people, obviously. It's one shot, one and you're done. Now, let's talk about the effectivity rate because it's getting a lot of flack for not being as effective as the Pfizer and Moderna. Let me backtrack a little bit and explain. Our flu shot, the ones we get yearly, our yearly flu shot, the most effective flu shot that we have had in the last few years has only been 60% effective. And that is the most effective one we've had, and we're happy with that number. So when we look at these numbers, I want to put that in perspective. You know, greater than 50% effective means that people, if you get a vaccine, more than half of them will not get a disease. And that is the key. That is the key. It has to be greater than 50% effective. Now, I will say Moderna and Pfizer, obviously, you know, they hit a home run. They're giving us 94, 95% effectivity, and that's amazing, and that really is unheard of. And so we're all blown away by that, but I think we've gotten used to that number, and so when we see anything that's lower than that number, than 94, 95%, we think, oh, it's not that good. That's false. This is a good vaccine. They tested the vaccine in 3 areas, in Latin America, I think a lot of it was in Brazil, in South Africa, and also in the United States. So when you break out the data from the Johnson & Johnson vaccine, it showed in the United States, it was 72% effective in the United States. And I think part of that is because in South Africa, they're dealing with the South African variant, which made it not as effective there. And we're going to talk about the variant coronaviruses in a little while, okay? But for now, the J&J vaccine is very effective, number 1. Number 2, it's easy, one shot, easy to store. Number 3, 72% effective. That's a great number, okay? It's a great number. And now, one thing I really want to stress is I'm going to talk about the Pfizer, the Moderna, and the J&J. And I'm going to do a quick comparison so we can all see the big picture of these vaccines and why I think the J&J is also a good vaccine, and why if you're offered the J&J vaccine, get it. Don't wait for another one. Get this one. Whenever you're at one of these vaccination sites, whatever vaccine they have available, get that vaccine. The other thing I will say for the Johnson & Johnson vaccine is for the people that have a history of severe allergic reactions and they're concerned with taking the Pfizer and the Moderna vaccines, I think this is a great option because we have not seen any type of allergic reactions with the Johnson & Johnson vaccine in the data. So again, if you have a history of severe allergic reaction, you haven't taken the Pfizer or Moderna because you're concerned, this is a good option. Now, comparing all 3 vaccines. Again, I just spoke about each one individually. You understand what type of vaccines they are, you understand their percent effectivity, and you understand side effects of what they have to offer and what concerns you might have with those. Now, the key take home is I made a very simple graph. This is extremely simple, but I really want to take this point home because remember, the key with any vaccine is we want to decrease the chance of you getting the vaccine, but also, we want to decrease the chance of you getting the disease with a vaccine. So we hope you don't get the disease, but the vaccine also hopefully helps you so that if you unfortunately are one of those breakthrough cases where you end up getting infected with whatever the disease is, it is not going to be as severe. So that's key, and I think we all forget this, that when we look at the Pfizer and we look at the Moderna, the percent effectivity, right? Pfizer 95, Moderna 94.1, and then Johnson & Johnson 72% in the United States. Okay, when they throw in the numbers from the South Africa group and when they throw in the numbers from the Latin America group, the number goes down to overall 66% effective. But in the United States, it's 72% effective. And everyone's comparing these numbers and saying that the Johnson & Johnson is not as good as the other 2. That's false. And I really want everyone to think about this. This Johnson & Johnson one has been tested more recently. It's been tested in communities where we have variants already floating in the communities. Okay? Now, Moderna and Pfizer, they were tested previously before a lot of these variants have been out in the community. So you think about it, these vaccines have been tested in people that probably didn't have a significant portion of the population with the variant strains. Johnson & Johnson has been tested in populations with variant strains. So that's also why we might see those numbers change a little bit. And I really want to stress that, okay? So overall, Johnson & Johnson, very good vaccine. And the bottom line is, You can have breakthrough cases with any of these vaccines. That means there's a very small percentage of people that are still going to get the disease despite getting the vaccine. But when they get the disease, it's going to be much less intense. They're not going to be as sick, and they won't be hospitalized. And the key I want everyone to notice is for Pfizer, for Moderna, for Johnson & Johnson, what do you think is the death rate of people that have received these vaccines? What is the death rate? How many people died from COVID after receiving a vaccine? In other words, they got the vaccine, they ended up getting COVID and being a breakthrough case and ended up dying. And here's the key answer. 0 for all three of them. 0. 0. Okay? So the next time someone says to you, oh, the Johnson & Johnson is not as good as the Pfizer and Moderna, I think that's false. I think Johnson & Johnson is a great vaccine. I think it's very effective. And at the end of the day, if you end up being a breakthrough case, which you can be with Pfizer and Moderna too, but if you're a breakthrough case with Johnson & Johnson, at the end of the day, there's no death with that vaccine. It protects you enough. So take home point, Johnson & Johnson is a good vaccine. So is Moderna, so is Pfizer. So when you walk up to your vaccination site and you're getting your vaccine and they say, this is the one we have today, your answer is going to be, great, give it to me. Whichever one you have, I want to get that one. Okay? And I really want to stress that because it's a very good vaccine. Now we're going to talk about a different set of vaccines. These are the ones that are coming either through the pipeline, have been stalled, or I'm going to focus on 2 vaccines that are not going to be here in the United States anytime soon, but they're being used worldwide. And again, I want to mention them just so when you hear them in the news, you understand what we're referring to when we mention them. So there's roughly 4. I'm going to start with the Novavax vaccine. This is the first one that we should be getting in the next month or 2 to the United States. Okay? The Novavax vaccine is a protein subunit vaccine, which we've spoken about before. It's a 2-dose vaccine also, okay? It's normal storage. It does not need the special storage that the Pfizer and the Moderna needs. So that's good. It's easy to store. And it is 90% effective right now. That's what the initial numbers are saying. Now, I'm giving you all this information, but the FDA, our FDA, has not received the data from the drug company yet. So this is what the drug company is telling us, especially the effective rate. But again, the FDA has not reviewed the data and it is not approved yet. But it's coming through the pipework, so we need to keep our eyes out for this, the Novavax. And again, the FDA should get the information supposedly at the end of this month. The end of March is when they're going to get the data from the drug company. And so once the FDA reviews it, we're going to get more thorough information about this efficacy rate. And obviously the side effects and all the other questions that we're going to have about this vaccine. But again, this is coming through the pipework. Keep your eye out for it. Okay, we should be talking about this in the next few weeks with more information. Second one I want to talk about is the AstraZeneca. I know you've heard that term, that name. It's a vaccine that we would have thought we'd already be using, but it's had some setbacks. Okay, and so I'm going to just briefly talk about it and why it's been stalled. It's a vector vaccine. Remember, that's the one that's like the Trojan horse, okay? It's a 2-shot vaccine, normal storage, again, so it's easy to ship and store. And right now, the number looks like it's 82% effective overall. Now, the problem with this vaccine is part of the study was done in South Africa, and the South Africa numbers were very poor. It actually showed it was less than 25% effective in treating COVID or protecting against COVID in South Africa because they have the South African strain, and it just did not do well with this vaccine. So this company right now is stalling this vaccine. They're trying to get more data. They're trying to figure out what they can do to make it more effective against the South African strain. So again, the AstraZeneca initially looked promising, but the South African strain has really showed that the numbers are not promising. And so they are trying to see what they can do to make this a usable vaccine. So we're going to keep our eye out for that one also, the AstraZeneca. Now, next one I'm talking about is called the Cinevac. This is a Chinese vaccine. It's an inactive COVID strain, so they have an actual COVID vaccine, I'm sorry, a COVID virus that they make it so it cannot infect you. And that's what they inject into your body, and that's how your immune response forms. All right? Now, this one appears to be about 83% effective. And when you read the literature from China, it tells you that it is quote unquote safe. Now, the reason we did not consider this one initially in ours, and try to include it into the vaccines that we're using is because China started using this one after their phase 2 trials. And what I mean by that is, remember, when you go back to the FDA says you need to have phase 1 data, phase 2 data, and phase 3 data. You've got to have all that information before they'll even consider any vaccine. And China jumped that step. They did not go through phase 3 trial before they started giving this vaccine out. So far they say it's 83% effective and that it's safe. It's being used in China, it's being used in Latin America. I have relatives, family members in Dominican Republic that are getting this vaccine now. And again, based on what I can read, it sounds like it's effective. So if the options are nothing or this, I told them go ahead and get this. But again, we do not have this option in the United States right now. The last one I'm going to talk about is a great name. It's called the Sputnik Vaccine, and this one is from Russia. And again, it's a vector vaccine, like that Trojan horse vaccine. It's got 2 doses, and it looks like it's 92% effective. And also, we are told it is safe. The data is now coming out because, again, Russia did the same thing China did. They started using this vaccine after the phase 2 trials, and so they did not go through all the trials, all the phases of the trials that we require to be able to look at the data of the vaccine and then possibly approve it. So again, these two kind of jumped a few steps, but right now they are being used, and I just wanted to give the names out so you're aware of them because you should be hearing about them in the future. Now, will we get these as an option for us? I don't know. I think right now with the Moderna, the Pfizer, and now the Johnson & Johnson, and possibly the Novavax, maybe in the next month or two, we might have enough to get everyone vaccinated. So I think we're doing okay with what we have right now. But again, these are the 4 vaccines that I really wanted to mention so that you're aware of them because you should be hearing about them in the future. Now we're going to address the variants that are worldwide, and especially I'm going to focus on the ones that are here in the United States and that we need to be concerned about. And I really want to just make a general statement about variants. They're a normal part of a virus's life. In other words, these viruses, they're going to cause mutations. They're going to have mutations. This is normal. The problem is when you have these viruses that are mutating, and the reason they mutate, by the way, is because they're trying to get smarter and they're trying to figure out how to live within our bodies and keep infecting us. That's their goal. That's their life goal, to continue infecting us. Because the longer they infect us, the longer they stay living. So the goal of the virus is that. Our goal is to stop them. Okay? So as long as the virus is alive, it's going to keep working on getting mutations and figuring out how to, outwit our immune system. And the issue with the variants is the longer we let this virus live, the longer the pandemic goes on, the longer people don't get vaccinated, the longer we don't wear masks, and we keep this virus alive within our communities, the more mutations, the more variants we have. If we have variants, as I'm going to show in a little bit, the key with the variants is once you've been infected with coronavirus and you do develop a certain level of immunity, we don't know how long that immunity lasts, but we know that for a few months, at least after your initial infection, you are immune from getting another corona infection. These variants are showing that they are infecting people that already have natural immunity. Those people normally would not get infected, but with the variants, they're showing that they are getting reinfected. So that's the #1 issue, and that's scary. The other issue we're seeing is people that are vaccinated, we're showing that some of these vaccines are not as effective for certain variants because these variants are getting very smart and learning how to get around our vaccines that we have presently. So we need to all get vaccinated sooner than later so that the vaccines that we have, as long as they're still effective, hopefully we can get them spread out, the vaccine. And so once we're all vaccinated, once we reach that herd immunity, whatever that number needs to be, then these viruses will die out. But again, we need to do our part. We need to get vaccinated, and we need to stop the spread of these viruses because they're just going to keep mutating and causing more variants and causing more problems for us. So these are the 5 variants that right now are in the United States, and I'm going to go through each one. First one I'm going to talk about is the B117 variant, okay? This is the British variant, the UK variant that we've heard so much about. Now, this virus is shown to be about 50% more contagious. In other words, it's easier to pass around, okay? It's easier to get infected with it. And right now in the United States, as of the last day or so, we have about 2,500 proven cases in the United States. And the way the numbers look, we suspect that going forward in the next few weeks, months, this is probably going to be the most dominant strain of coronavirus in the United States in the near future, as it just keeps spreading and spreading and spreading. Now, one thing I do want to say, I have numbers here about how many cases we have in the United States. Right now, we are not testing everyone that gets coronavirus. And so we are testing a very small part of our population to see which virus they have, okay? So these numbers, I'm sure, are much lower than they really are because, again, we just are not testing everyone to see which specific virus they have. And I want everyone to keep that in mind because these numbers don't sound like very high numbers. But again, we're testing a very small amount of the population, and we know these are already here. So the bottom line is if they're here, we know they're going to be spreading. So keep that in mind. All right. Second one I'm going to talk about is the B1521. This one is the South African variant, okay? Now, the scary thing about the South African one is it has this specific mutation, which is just giving us all kinds of headache in the science world, okay? The mutation is the EU8UK mutation. We call that the EEK mutation, okay? So when I say the EEK mutation, this is what I'm talking about. And what this does is you've got this virus that's been mutating and mutating. So this very smart virus that we found originally in South Africa, and it's caused mutations, and it's formed this one mutation that's called the EEK mutation. What that does is the spike protein that we always talk about in the coronavirus, that spike protein, the little spikes that come out of the virus, this changes the spike protein. So think about that. If we have all these vaccines and they all focus on finding that spike protein and you know, getting rid of the virus that has the spike protein, if this is changing the spike protein, now those vaccines, that's why they're not working so well in the South African variant, because this one changes the spike protein that the vaccines are looking for. So the vaccines are looking for a protein that these viruses are changing, and they're not finding that protein. Okay, so this is a very scary mutation. This is the EEK mutation. It changes the spike protein so that virus lives longer in your body. Also, it evades your antibodies. Remember, when you get infection or you get your vaccine, your body makes those memory cells, and it makes those antibodies to help fight your infection when you get exposed to COVID. Well, this virus with the EEK mutation is able to evade your own antibodies that you've made. So that makes it more stealth, more scary. And another thing is we've noticed that you can get reinfected when you have this mutation. And what I mean by that is, remember, you get a COVID infection, you're going to have a certain amount of months of immunity. We don't know how many it is. We assume it's just at least 90 days to 3 months. Could be longer for some other people. But within that time frame, we're seeing that people that had coronavirus are getting reinfected with this strain of the coronavirus because it's able to overlook the patient's own immunity that they've developed from a previous infection. So that's scary, okay? So it can reinfect. And then the other thing is, as I mentioned, it will decrease the efficacy of the vaccines. Because again, all the vaccines we have now that are being used focus on that spike protein, but this EEK mutation changes the spike protein of the virus. So this is a very scary mutation. Makes this virus very strong. It's able to kind of fight around and evade some of the things that we've come up with to help fight it. And so this is very worrisome. We need to be aware of this, okay? And this is the South African variant. Next variant is the P1 variant. This one is the one from Brazil. This is also another scary one. Why? This one also has an EEK mutation, okay? Again, this one you can get reinfected if you've already had an infection. And also, if you get your vaccine, the vaccine might not work as well in this version of the variant, okay? And as of now, there's only 10 cases that we've been able to test and find in the United States. But again, we're testing a very small portion of our population that are COVID positive. So I suspect if it's 10 cases that we found, I'm sure there's many, many, many more that are already out there. We just haven't been able to test them and find them, okay? Now, 2 other ones that are coming up. Now, these were all abroad. One was from the UK, from Britain, the other one was from South Africa, the other one from Brazil. And they've come into this country, the United States. These 2 that I'm going to show are US grown. In other words, these viruses we think have been here, they started mutating here, and they formed here in the United States. These are our own coronavirus variants. First one is the B1527. This one is, again, US grown, and it's in California. Significant portion of the population in California has this variant right now, okay? The numbers are really getting high in California with this variant. And the last one I'm going to discuss is the B1526 variant. This one, again, is US grown. It developed here in the United States, and it's in New York. And this one is scary because this one also has the EEC mutation, okay? So these are the variants that we're dealing with right now in the United States. These are the main 5 variants. Again, the numbers seem very low of how many cases we found, but we are just not testing everyone. We don't have the capability right now to test everyone to see how much of these variants do we really have. And it's going to be interesting to see as our vaccination numbers go up, going forward, it's going to be interesting to see how many breakthrough cases we have. In other words, how many people got vaccinated and ended up getting coronavirus infection. It'll be interesting to see when that happens, if we're able to test those people to see if those are the variants that are reinfecting people. So again, when we talk about vaccines and we talk about the rollout of the vaccines and then we talk about people getting vaccines, we see a lot of people frustrated because they're not able to get their vaccine. But I also see, which is more concerning to me, is a lot of people saying, I'm not going to get vaccinated. This is fine, I'm healthy, I'm not worried about it, and I'm not going to get vaccinated. Well, I just gave you 5 examples of a virus that's stronger than the original coronavirus that we have here in the United States. It's spreading in our communities. We're not sure how strong our vaccines are going to be against these. And this is the #1 reason we all need to get vaccinated, because half of us get vaccinated and the other half don't, right? That half that does not get vaccinated, they're going to be getting these infections. They're going to be spreading this infection. And remember, the longer these variants spread, the longer we have coronavirus spreading within our communities, the more variants are going to form, the stronger variants are going to form. And right now, when we look at these, the EEC mutation is the scary one because it's very aggressive and it really evades our immune system. Well, imagine giving these even more time to get stronger and to get smarter and to get better. And then we'd have to start at step 1 all over again, saying, okay, now, this many months out, we have all these new mutations, our vaccines are not effective, we got to start over. We don't want to go there. We want to end this pandemic the first time around. So vaccination is the key for everyone. And I really need to stress that. This is why we all need to get vaccinated, and as fast as possible. Okay? This is not one of those, I'm going to wait another year and make sure everything's fine and get my vaccination. No, you don't want to do that. We do not want to give these variants time to get even stronger and more variants to come out, because then the pandemic is going to keep going. It's never going to really be over. It's going to keep going, and it's going to keep going. And again, this is one of these things that we need to end it, and aggressively. Get your shot, get your vaccine when you get your opportunity. In the meantime, you have to mask up whenever possible. Double masking is an option, especially if you're in a community that is showing that you have high percentage of like the South African or any of these variants. You know, if you can double mask, that's not going to hurt. That's only going to help as long as you can tolerate the double mask. And we just need to be safe and make good choices. All right, now herd immunity is the next subject that we're going to discuss. And it is a huge subject because we're nowhere near herd immunity yet, but there is a goal in sight. And again, the key to herd immunity is people getting vaccinated. And I want to explain why. It's a very basic reason, but it makes sense, and we need everyone's help in getting this achieved. So herd immunity, by definition, is just when the community is protected from a certain disease, when the majority of the people have either gotten the disease and have immunity themselves, they've developed their own natural immunity, or they've been vaccinated. So these are the two ways that we can reach herd immunity. And the key is, once we reach this certain level of herd immunity, whatever it is, 70%, 80%, 90%, when you have that percentage of the population with either vaccinated or their own natural immunity, then the virus does not spread. The disease cannot spread. That's the key. And the reason we need this is because we do have a certain percentage of our population who, for whatever reason, medical issues, are not able to get vaccinated. Okay? The very young right now cannot get vaccinated. In the United States, if you're under 16 years old, you cannot get vaccinated. And children, roughly about, I think it's something like 24% of the population is the pediatric, which is 18 and under. And so that's a big portion of the community that cannot get vaccinated right now. Okay? It's a little bit less than that, obviously, because you can go down to 16, but still, think about that. You know, we have roughly about 24 million kids, pediatrics in the United States, and if we cannot vaccinate them, we need to get vaccinated as adults. We need to do our part to help gain herd immunity to keep them safe until they can get vaccinated. And the bottom line is, once we have herd immunity, the key is that virus dies out. That's how the virus dies out. When you have this immunity and the virus has nowhere else to go and to spread and to grow and to infect, to mutate and to keep going. So that is the key. That is how we stop this pandemic. We need herd immunity. All right, now talking about herd immunity, we're going to continue the conversation, and I want to talk about where we are in terms of vaccinating in the United States, okay? As of yesterday, these are the numbers, the most up-to-date numbers. Right now, we have given out about 78 million doses, which is about 15.6% in the United States, total, all the doses that we've given. Now, I'm going to break it down and show the Florida doses and the Georgia doses, okay? Now, in Florida, 15.1% of our population has received the first dose. And remember, right now, all we have is the Pfizer and Moderna doses, vaccines to give out. These numbers do not include any of the Johnson & Johnson numbers because those are just being rolled out now. So going forward, we should see more numbers, and our numbers are going to go up. But right now, we're talking just about the Pfizer and the Moderna. So first doses received in Florida so far is 15.1%. Received in Georgia is 12.2% only. And right now in the United States, as of this morning, up to 16% have received that first dose. Now, second dose in Florida, 8.4% of the population is fully vaccinated. They've gotten their second dose, either Pfizer or Moderna. In Georgia, 7.1% of their population has gotten their second dose. In the United States, only 8.1% of the whole United States population has received their second dose, okay? So that's where we are in terms of percentages of reaching our herd immunity. Remember, this is what we're talking about, herd immunity, and this is how our vaccination's looking so far. Now, another interesting statistic that I found was what percentage of our vaccines have we actually used? In other words, you know, at the end of the day, have we had to throw some out? Have we not been able to utilize all our vaccines? And it's interesting because when you look at the data where I found this, where it shows all the states, all the US territories, and it shows these numbers, you know, no one is at 100%. No one has used 100% of the vaccines that they've been allocated. So right now, in Florida, we've used about 75% of the vaccines that we have been given. Georgia is at 68%. And overall in the United States, the rough average is about 77% of all the vaccines that we have been used, that we've been allocated. So it'll be interesting to see, hopefully those numbers do end up going up as everything gets more streamlined. Now that we're going to get the Johnson & Johnson vaccine, you know, those numbers should start going up faster, because remember, Johnson & Johnson is one shot. So we're going to be able to get a lot more people fully vaccinated with that one shot faster than with the Pfizer and Moderna. Now, I want to talk about the herd immunity number. You know, initially when this started, we were all thinking, well, maybe 70% will be good for herd immunity. In other words, we get 70% of the population vaccinated. That should be good enough to get herd immunity. You know, this virus forming these variants, and now some of the vaccines are not as effective, we're looking at our numbers and trying to decide what is going to be a good number for herd immunity, where we can say that we've reached it and we're safe. And right now, anywhere from 70% up to 90% of our population needs to be vaccinated for us to reach that herd immunity that we need, so that we're all safe from this pandemic and hopefully we can stop the pandemic. So right now we don't have a specific number, but between 70 and 90%. And I'll tell you right now, that number goes higher the more infectious the virus is. And what I'll say is the measles pandemic. The measles is the most highly infectious virus we've ever known. And for the measles pandemic, they needed higher than 90% vaccination rate to get rid of the measles, okay? That's a lot of people need to get a shot in the arm to get rid of that one virus. And so with the variants coming out, the vaccines not being as effective, not all vaccines being as effective as we want them to going forward, we don't know what that picture is going to look like. Are these vaccines going to be able to pull us through and be as effective as they need to be? Are they going to be getting less effective over the next few months with these variants? We don't know. So for now, herd immunity, when you talk to the experts on this subject, they're saying between 70 and 90% of population needs to be vaccinated. That's a lot of people. That's a lot of people. And so based on those numbers, I was able to find a guideline as to how fast we're going to reach those numbers. So right now, with just the Pfizer and the Moderna vaccine, we're getting 2 million people vaccinated per day. That's the numbers we're trying to get to, okay? And that looks like that's what we're able to achieve right now. Every day, 2 million people are getting that first vaccine, that first shot, okay? And as long as we can keep this up, keep these numbers up, 2 million daily, we were able to extrapolate what we think going forward our numbers are going to be. So based on this, of 2 million people vaccinated daily, by June 16th of 2021, we should have 50% of the population vaccinated with their first shot, okay? Now, you go into August 16th of 2021, we should have about 70%. Is that going to be good enough for herd immunity? We don't know. But based on these numbers, around August, we should be able to get that percentage of our population vaccinated. And finally, back in October, looking forward to October 16th, 2021, based on these numbers, if we continue consistently on these numbers, we should have 90% of the population vaccinated. So this is an interesting number. Again, this is just a theory. I don't know if we're going to reach these numbers. I don't know if we're going to reach them sooner. Obviously, we'll keep talking about that and keep everyone updated as we get more numbers. But right now, based on what we're doing, this looks like the time when we should be able to get to the point where we start using the word, we're at herd immunity. We're almost at herd immunity. We've reached herd immunity. Okay, I want to listen to those numbers. I want to hear those numbers, meaning that we all got vaccinated. And this is the timeline right now that looks like we should hopefully be able to reach that. A question I get frequently is, once you're vaccinated, do you need to wear your mask? And so I'm going to offer the answer and giving you a little bit of background data so you understand where it's coming from. We are going to talk about something called transmission rates, and that just means if I have COVID or I'm exposed to COVID, how easy is it for me to transmit it to someone else, okay? Now, vaccines. Vaccine is the big game changer in this whole pandemic. The more people vaccinated, the more the virus cannot spread. The more people vaccinated, the more we're going to reach herd immunity and the virus is going to die off, hopefully. That's the goal. Now, can that change? Of course, but right now that's our goal. And so the vaccine being such a game changer, I want to explain how it does that. So once you get your vaccine, what happens is, say I get exposed to COVID, correct? I'm not going to get infected with COVID. I'm not, because I've already been given the vaccine. I have immunity. I should not get infected with COVID, but I will have the virus if I'm exposed to it, and I can probably pass it to someone else. So that's the problem right now. We're asking people that have been vaccinated to go ahead and keep wearing your mask, because if you are exposed to COVID, you can pass it to someone else. You probably are not going to get infected with COVID, but if you're exposed to the virus, you can give it to someone else and they can get infected, okay? So you're like the vector. You give it to someone else. It passes through you. You don't get sick, but you're able to pass it to someone else. Now, once you get vaccinated, we don't really have any specific numbers about what how much does that decrease, okay? So when you get vaccinated, what we think happens, obviously, is when you're exposed to that COVID virus, okay, it doesn't get into your system because your immune system fights it off. So it doesn't really get a chance to get into your system and build up a big number of virus in your system so you can pass it to someone else. What happens is you get exposed to COVID, you've been vaccinated, you fight that infection so you don't get sick. And because you've had the vaccine and you fight it, that viral load never gets very high in your system. So you never get a big percentage of COVID in your system to be able to pass to someone. So the vaccine causes your viral load to be lower when you do get exposed to COVID. And then when you have a lower viral load, you have less virus to be able to pass it to someone else. So you don't really transmit it as often. And when you're decreasing your transmission, you don't get the COVID infection. So that's the key with a vaccine. That process happens. Now, we're getting early data that's coming out when a lot of the scientists are looking back and all the information we have from the earlier studies, and going forward, as we're vaccinating millions and millions of people, we're getting more studies and we're asking more questions. And right now, the preliminary data, this means it's early on, it's not definite, but it looks like these are the numbers that you will decrease transmission once you've been vaccinated. So what that means is if you've gotten the Pfizer vaccine after your second shot and you've reached your full immunity with Pfizer, you have probably an 85% chance of passing that coronavirus to someone else, okay? If you have Moderna, it looks like a 91% chance of transmitting corona to someone else. Johnson & Johnson, they've already shown in the studies that it decreases transmitting the virus. Once you've been vaccinated, you don't get sick, but you can still pass it. But Johnson & Johnson shows you have a 74% chance of decreasing how often that happens. And then the other vaccine that looks like maybe in the next month or two we might be getting is the Novavax. And that already is showing that it does decrease the transmission also, 67%. So the bottom line is once you get your vaccine, you fight the virus so you don't get infected, but it also looks like it fights the virus so that you don't form a lot of virus and therefore you don't pass it as easily to someone else, which is a good thing. So I think going forward, once we get more definitive data, we're going to be able to say you're going to be able to take your mask off. As long as you're in a group of people that have all been vaccinated and have all been past Moderna and Pfizer, their second shot, Johnson & Johnson, their first shot, Novavax, the second shot, okay? Once you've reached your full vaccination, after that, you've reached your full immunity, you'll probably be able to take off your mask and be around other people that are vaccinated. But remember, for now, we have a bottleneck with the vaccines. We don't have vaccines for everyone right now where we can all be vaccinated within the week. That's not happening. It's a process. It's a rolling out process. It's a slow process. So right now we still need to be cautious. So again, early data looks like, yes, we're going to hopefully decrease the transmitting the coronavirus to someone else once you've been vaccinated. That's good news because that means eventually we're going to be able to take off our masks. Eventually. We're not there yet. Keep wearing your mask, but it's good news that looks like in the future we hopefully will be able to take our masks off. COVID pandemic. What is the big deal? Why 14 months later into this pandemic are we still talking about it? Why are we still having concerns? Why is it so important to get vaccinated? Why do we keep going on and on about this? Well, the reason is because by now we all know this is not just a flu. This is not something that most people will get and get through it. This is not that. This is a pandemic with a real virus that causes harm. And I really wanted to point out the numbers up to this date of how many people have been affected, how many people we've lost. And I'm hoping it really resonates with those people that are watching and just not really sure how serious this is or not really having any concerns about this virus. I hope at this point you're wearing your mask, you're socially isolating, socially distancing also, and just doing the proper behavior to make sure that we can really beat this pandemic. Because the longer it goes on, the worse it's going to be for a lot of people in our communities. And so I really want to just go through some of the numbers and really bring us all up to date into what we've dealt with. First time it presented here in the United States was in January of 2020. It is now March of 2021, so 14 months. We've had 14 months of this pandemic, okay? Right now, as of this morning, we have 28.8 million people that have been tested positive for COVID in the United States. 28.8 million people that have been positive. We have also, up to this point, 519,000 deaths. And there's people that will argue these are not all deaths from COVID. I would love to hear from our viewers those questions that you have about how we decide these are COVID deaths, because I've heard some people really downplay this number or not believe it at all. And that's frustrating because there's 519,000 family members of these deaths that I'm sure they believe it was a COVID death, and it is a legitimate COVID death. And the worrisome thing is we have not controlled this pandemic. This is 519,000 deaths in 14 months. It's just going to keep getting higher and higher, that number. And so we really need to combat this disease, and this is why. Now, the other concerning thing for me as a physician is we've 14 months in. And out of these 14 months, what has been the worst month? What has been the month where we've had the most deaths in the United States? It was January, 2 months ago. So in other words, a year into the pandemic is when we had our worst month. On average, we had 3,100 deaths a day on average. Every day in January, at least 3,100 people died. And 6 of those days in January, we had more than 4,000 deaths. These are deaths. These are not people that got COVID. These are people that died from COVID. 12 months into this pandemic, all right? 12 months into education, knowing you need to wear your mask, knowing you need to socially distance, knowing you need to wash your hands. 12 months into that education to the public, 12 months into us having a better idea of how deadly this disease is, 12 months into all that, we had our deadliest month. So this is not over. Right now we have probably 17% of our population vaccinated as of today with at least the first shot of either the Pfizer or Moderna vaccine. We're just getting the Johnson & Johnson approved, and we're going to get Johnson & Johnson vaccines now out into the communities. We need to get vaccinated. We need to do better. We need to wear our masks. We need to socially distance. And we need to keep this up so that we can end this pandemic. And so this number of all these deaths does not keep continuing. And remember, this has been in the last 14 months. If we don't get control of this pandemic with all these variants coming out, with question if our vaccines are going to work against these variants, we are going to be in trouble. We really are going to be in trouble. So I hope that everyone who is watching this really takes this to heart, takes these numbers to heart, really thinks about them and sits with these numbers and thinks, you know what, I need to do the best I can to help end this pandemic. I've been vaccinated. I have my Pfizer vaccine. I feel pretty good. My family members are all getting vaccinated. My teenagers, well, they're 18 and 20 right now, but I promise you the first chance they get when they're allowed to get vaccinated, they're going to get vaccinated. Get vaccinated when you have the opportunity. Don't miss your vaccine spot. Get your vaccine, follow the rules, and hopefully we'll be able to end this pandemic, and this number is not going to keep increasing significantly.